Welcome, everybody, to the practitioner series at the Lyme Disease Resource Center. Today, we're welcoming Dr. Nitya Jessica Eisenheim, a naturopath who's licensed in Massachusetts and Vermont. She has a clinic called Cedar Rose Naturopathic, and she's talking today about naturopathic treatments for Lyme disease. And we'll be having a discussion with questions and answers after Nitya gives us a brief introduction to her practice. Thank you so much for joining us today.
Yeah, thanks so much for having me. I'm really glad to be here. Um, so I'll just give a little introduction about myself, my practice, and then if you have questions that come up, maybe jot them down because there'll be time, lots of time. I want more time for questions and not so much a formal presentation. I'm a naturopathic doctor. One of my specialties is Lyme disease and tick-borne illnesses, and I'm here to share my unique approach to healing from Lyme disease and to give you some hope that you can recover. And I don't think that Lyme has to be a death sentence. I do think that you can get help from a Lyme literate doctor, and there's a lot of choices out there, a lot of information. So hopefully we can sift through some of that, get you some clarity. And Lyme disease is common in our area. Often people are misdiagnosed, and that's often why people are sick for long periods of time when it goes misdiagnosed for many, many months, many years, not getting proper treatment. And so you might even be somebody or know somebody that's gotten a standard course of antibiotics after being correctly diagnosed, or maybe you tried herbs and you're still feeling sick, and you might have some questions about that. So some things that we can talk about, you can answer questions about that I've thought about are what a holistic or naturopathic approach to treating Lyme disease or tick-borne illnesses might look like, what naturopathic medicine is, why you might be sick even though your labs are normal and you've taken antibiotics already, what my unique approach is to Lyme recovery, top warning signs of Lyme disease, preventing and treating early and later stages of Lyme, tick-borne diseases, how to take herbs and supplements and other natural treatments alongside antibiotics and other pharmaceuticals, and then what the benefit of taking herbs and supplements and other natural treatments for treating Lyme, tick-borne illnesses, or supporting conventional therapy, and then what that might look like in children. And just as a disclaimer, I can't give out any specific individualized medical health advice here, but you will have an opportunity to learn more about how you can work with me at the end of the talk. And then a little bit more about just my background is that I'm from one side of my family from upstate New York. My husband's family, they pretty much have all had Lyme disease. And I've lived in Albany, New York, the capital region, which is just one of the not so great areas for picking up Lyme. And pretty much the whole family has had Lyme, have Lyme. Currently, the dogs have had it. So I've seen all different stages of Lyme, and I've seen them suffering from fatigue and pain, digestive issues, depression, mental health issues. So I've seen it in my own family. So I have that firsthand experience, and knowing about the ups and downs and the roller coaster ride that it can be. So not just from a clinical perspective. And, it's really hard to it's hard to see your family suffering and feel like you want to do something. And I was already into nutrition and herbalism at that time. And then when I went to Seattle to naturopathic school at Bastyr University, my husband started pursuing different treatments for chronic Lyme. And then we started learning about how much information, how overwhelming, how everybody practices so differently, and about really empowering him and empowering patients and us to learn more about the whole process, really. And I've really learned the most from my patients, I would say, having that firsthand experience. When I worked up in Brattleboro, Vermont at the Windhorse Naturopathic Clinic, I worked as a primary care doctor. So I saw a lot of acute Lyme, and I was able to treat it right away and take care of it, which was very satisfying. And then also seeing all the sort of intermediate and later stages of Lyme. And I mean, I still learn so much from my patients. And in terms of a little bit more about the schools I went to and a little bit more of my background is I was trained in a 4-year in residence full-time naturopathic medical school, which is recognized by the Federal Department of Education. It's called Bastyr University. And then I practice as a Vermont and Massachusetts naturopathic doctor in Massachusetts. And then I am also, as an update, I'm going to be practicing in Brattleboro a couple days a month and maybe more like a day a week eventually, because I can prescribe in Vermont where I can't prescribe pharmaceuticals in Massachusetts. So, and then I do 50 hours. I have to do 50 hours of continuing education every 2 years, including pharmacology for my Massachusetts and Vermont licenses. And I go to lots of Lyme conferences to get updated. And I also give lots of talks and webinars here through the Lyme Disease Resource Center and through other venues as well. And then there's a lot of webinars, old webinars available on my website as well. And yeah, and so my approach is just a little bit different, and that's kind of what we're here to learn about. I'm really looking at the whole, it's not just about the herbs and the supplements, but also naturopathic medicine. As a naturopath, trained naturopathic doctor, we look at treating the whole person. And so really treating people, not diseases. And really every treatment plan is different. And so this is really for you if you're curious about naturopathic medicine or about herbs, supplements that you have questions to, for your, as an adjunct to your current conventional Lyme treatment plan or standalone therapy. And this is for you if you feel like, you've been to a million doctors, everyone's telling you you're fine, there's no clear diagnosis, whatever place that you are in, there's probably something that you have a question about, you could ask about. Or maybe you're here because you know somebody with Lyme disease or you have a family member, and I feel like you're in the right place. And so what's unique about my approach is that I'm really looking at what's going on in the whole body, not just focusing on killing the microbes and the bugs, but what's also going on in the organs, what's also going on in the brain, the liver. Has there been toxicity from antibiotics or from the treatment itself that we now need to help you recover from a little bit? And so just as a short patient story is I had this one patient who came in to see me, had been to another clinic in the area for Lyme disease. And when she came in, she really felt helpless and she felt like giving up, and her body and mind were ridden with pathogens. And she felt like her other doctors weren't listening to her. They didn't get it. She just kept saying like, what we're doing is not working. Like she had been on lots and lots of antibiotics and she was still sick, and it's been like 2 years now. She was debilitated. She felt like giving up. She couldn't go out on walks. She couldn't socialize, couldn't work. And she had searing joint pains, brain fog, fatigue, heart palpitations, and severe anxiety. So a lot of limitations. And like I said, she'd been on a lot of antibiotics. And this was also just as mentioned as like this was an integrative clinic. And so a lot of times integrative clinics will say that they're, doing the naturopathic treatments or doing natural treatments, but they're doing antibiotics plus maybe, some probiotics or something, but it's not really kind of looking at like the whole picture and what's going on. And that's what I found with this one patient. So we tested her for chronic viruses, co-infections, depleted organs and systems. And it really wasn't until we supported her adrenal glands, her brain, her thyroid, and her liver that she was able to start feeling better again. And we did do some things for the Lyme and other co-infections eventually, but that's not necessarily where we started because she had already been on the antibiotics for 2 years with kind of feeling like she was stuck basically. And then after 2 months, she slowly started to improve. Her energy slowly started to improve, digestion, brain fog was better, her anxiety was better, her joint pains were better. And then 2 years later, she reported feeling 75 to 90% better, except for occasional flare-ups. And then she says she feels joy at times that she never felt before. She can work, she can socialize. She was able to have a boyfriend, which she really wanted. And then 3 years later, she's married now. So that's really great for her life. And then what I found is working for my patients is that if I assess for the weakened organs in the systems like the small intestine or the immune system and find out, was there toxicity from some of the medications, or was there, or just damage, inflammation from the pathogen itself. Then if we strengthen that, we rebuild that, that really helps with the Lyme recovery side of things. And also you can have less flare-ups, you can feel better that way, start tolerating other medications and other necessary treatments too. So really it's for me, I find it's a truly integrative and collaborative approach. It's not like it has to be one thing or another. I think just conventional, just holistic, there's a lot that we can do together. And so what I find is missing from a lot of approaches for healing and treating Lyme disease is that just focusing only on the pathogens, not looking at the whole person. And, as a naturopathic doctor, I'm trained to look at all the different systems, how they're related, instead of, just being a specialist focusing on like one thing, this thing, that thing, that thing. And it's complicated, right? When we have a tick-borne illness that's been, especially if it's gone on for 3 or more months without proper treatment and proper diagnosis, then there could be inflammation going on in multiple parts of the body. And then there's sometimes also, like I said, either it's just like it might be your small intestine, or you have diarrhea from the treatment, or you have gallbladder issues or something. And it's like, well, okay, we have to work on that. Otherwise, it's going to be hard to take all the supplement and take anything really if your digestion isn't working well. And then also with naturopathic medicine, the focus is more on strengthening the system, kind of like I was talking about. And then I feel like with chronic infections, like I said, that's just so important because it's kind of like otherwise we're kind of dumping, even when we're just doing herbal antimicrobials, if we're kind of just only doing that, whether it's like pharmaceuticals or herbs, we're kind of missing some things if we're doing that. And we're like, oh, I have all this liver damage. Well, okay, we need to, we're not going to be able to really get better until we heal that liver. So yeah, that's kind of what I have to say. What questions does everybody have?
We had some questions earlier with the emails, and we had one person saying, I'm trying to decide if it makes sense for me to continue searching for an effective treatment for what I believe to be long-term Lyme disease.
Okay, is that person here? Want to say more? So, I mean, it's kind of, I think a lot of people feel that way at different times. I don't know. I guess I'm not really sure how to address that question without knowing more of the story. But I feel like a lot of people do get to that point at some point in the Lyme journey where it feels like it's just overwhelming. There could be lots of different scenarios for that. It could be somebody who's been on isn't diagnosed yet and is trying to work with their primary care or going to the rheumatologist or neurologist, and they're trying to, get different diagnoses, or they're starting to do some of the workup and tests and for Lyme and tick-borne illnesses. It could be somebody who's been through multiple round of antibiotics, whether they're IV or internal, or they yeah, I mean, I see people that have been to a lot of, they've been to a couple of other doctors and have tried different things. And you kind of, I think it does get frustrating, but usually when I do an initial intake, like an initial 90-minute intake with someone, which can be in person, I forgot to say also can be telemedicine. But typically there's some path that hasn't been explored, or some I'm not so much a fan of like, okay, let's just try this treatment or this treatment or this treatment. I kind of like to look over like, okay, what are your symptoms currently? What have you tried? What are your labs looking like? What is it? It's like, do you have mold in your living space that hasn't been addressed? I try to kind of look for the clues, like kind of look broader, like, okay, what's kind of been missed? And sometimes also when there's like neuropsychiatric symptoms, and I'm not saying this person has that, but if there's any kind of like depression or anxiety or mood stuff, like sometimes that's also from the inflammation, the neuroinflammation from the disease itself. So has that been addressed? You know, there's a lot of different things. So that's
So
right.
there's
Yeah.
there's hope. There is hope.
There's definitely, yes, there's definitely hope. And there's definitely a lot of things that I think are a lot of cards unturned. Definitely. Yeah.
Okay, another question is similar. This is someone who has had 7 diagnostic cases, and they have dysbiosis and concentration issues. How would you approach that?
Yeah, that was also like another question that I saw that was a little bit vague to me. Is that person here or I want to say
I
my
am.
yeah. Great.
That's me.
When you say diagnose, did you mean like diagnoses?
No, no,
Okay.
my gut is bad from all the years of antibiotics. I was
Yes, that's
17 with
common.
my first
Yeah.
case, and I was 56 with my last case. And I had rashes with all but one. I have a farm, so it's a little
Mhm.
difficult when you know, even with preventive on you, they're just so tiny in Pennsylvania. I think we've
Yeah.
outpaced you in Lyme disease cases. Am I right? Pennsylvania? At
You have
least
what?
that's what the stats. I think we've outcased your state for Lyme disease cases.
Oh, yeah, it's possible. I don't know. I haven't looked at that recently. But yeah, it's definitely,
Yeah,
yeah, I think the warmer states are, yeah, Pennsylvania's, I think, pretty bad because there's not as much, especially like as it's getting warmer with climate change and everything, there's less freezing. And so I think
yes,
the warmer, the sort of in between those central states, yeah, I think you guys are getting hit a lot more. But yeah, that's kind of common. We see that a lot with gut dysbiosis, and that's definitely one of the things that I specialize in is gut healing, especially with Lyme when there's been a lot of antibiotics. I typically, I mean, I don't in general, I would typically start with the initial intake and getting all the symptoms on doing a physical exam if somebody that I see in person. Um, and then I usually do a GI map stool test. And then if it seems like depending on the symptoms, if there's a lot more kind of bloating, diarrhea, constipation, and brain fog too, then I also want to do a small intestinal bacterial overgrowth test, which is a breath test. Because there are not supposed to be any bacteria or much bacteria in the small intestine. And when there is, it causes a lot of havoc, a lot of symptoms, a lot of pain for a lot of people. So sometimes we see that. Sometimes we see gallbladder issues. So I would want to do like liver, like blood tests for liver and gallbladder. And then the GI map stool test is by Diagnostic Solutions is a really great comprehensive stool analysis. There's other ones out there too. That's just the one that I use. But that looks for inflammation in the gut, and it does that. The first page, it looks at pathogens. So things that you would get from like if you have, diarrhea from like food poisoning and you have salmonella, like it looks at like E. coli and salmonella and parasites. And then it also looks at hidden sources of inflammation like gluten. It looks at how your liver and gallbladder are doing. So it has a lot of functional things on there. And then it also has a whole other page on like opportunistic bacteria and things that you don't get when you go to like a regular GI office, a regular gastrointestinal office, or your primary care. So that's a really great tool that I use for folks. And then so I usually do that. Typically, I'm doing either one of those tests, and then once we know what we're dealing with, we're looking at. I mean, most people are getting, depending on again what's going on with somebody, but most people are getting some type of probiotic. There's a lot of different ones now, and it's getting more and more tailored to specific treatments. So it used to be just sort of like general probiotics, and now it's like probiotic for kidneys and liver and all this stuff. So, yeah, typically people are getting probiotics, and then again, depending on what's going on, I use a lot of this gut heal powder for people. But typically, with the gut dysbiosis, it's like we want to identify if there is a overgrowth of a bacteria or a fungus. Sometimes the Lyme or the Bartonella, for example, can get into the gut and cause SIBO and gut issues itself. So it's like sometimes it's a little bit of a chicken and an egg trying to figure that out. But if it's kind of clearly like sometimes it's very clearly from the antibiotics themselves, then it's really at least 90 days of a gut healing protocol with probiotics and then addressing, like if there's SIBO, usually have to do some specific antimicrobial herbs like garlic and oregano oil are some examples that I use. I also use this product called Biocidin, which has some combination of like essential oils and different herbs in it. Like it has gentian and raspberry leaf and wormwood, and it's kind of like a broad spectrum gut antimicrobial herb. And it's very strong. You only do a couple of drops of it to start, but it's really effective for a lot of gut dysbiosis patients. And then typically I'm doing a gut heal powder after that for 90 days, but it takes 90 days for the gut to heal. But it's like 3 to 6 months really of a gut healing protocol. The gut heal powder that I use with most of my patients has slippery elm and marshmallow and astragalus in it. And that helps to balance the immune system in the gut. And then it also helps, it has what's called mucilaginous herbs, like the marshmallow root in there. And that actually helps to heal like the mucin layer, the mucus layer of the gut. That's where all the immune system is in there, whether it's like overactive or underactive. It helps to heal that and actually helps to heal inflammation. We use it for sore throats and heal ulcers. They're called vulnerary herbs. They actually help to like heal the tissue. They can help transform, like when people have like GERD, like heartburn, and you can some people have like the Barrett's esophagus, which can lead to like cancer and stuff. It actually helps to transform those cells so that they're not as they're less cancerous, prevent some of that precancerous cells. So there's a lot of good benefits to those. And then leaky gut, we have to address leaky gut when we're dealing with gut dysbiosis and food sensitivity. Sometimes when there's just, you're sensitive to every single food, then we're talking more about leaky gut, where there's supposed to be tight junctions like this kind of next to each other in the barrier between the small intestine and the blood, because their small intestine's breaking down all the nutrients, and then the blood, it's right there, the bloodstream. So anything that's not getting broken down, like a protein that you're not digesting, can get into there and trigger inflammation and all kinds of symptoms, like systemic symptoms. So there's a lot of stuff. And then that's how sometimes viruses and bacteria, metals can get in that way too. So that's kind of generally, there's probably a lot more too. I do a lot of hands-on body work too with patients that are in this area. There's a certain type of belly massage that can also really help that I do with patients. And that helps also with detecting like what's going on in the organ. So I can actually do listening and feel. It's like a manual listening that I do with the organs to feel what's going on. And sometimes I've had patients where I'm like, something's wrong with your liver. Like it feels really off. And then a couple of months like later, their liver enzymes are like crazy off the charts. So there's things that we can do that I do even before they show up on labs as like something really wrong. So that's kind of the benefit of that, and also helps to treat and heal those organs as well. And that can be really helpful while we're doing kind of figuring out like what is causing the issue and while you're waiting for like all the other things to kick in. It can help calm down a lot of abdominal pain and bloating and things like that.
Thank you.
Yeah, you're welcome.
Can I jump in with a question? Spurt here. Can you hear me?
Yes.
Okay. Do you collaborate with physicians around care? Because a lot of people have, had some testing. A lot of co-infections aren't tested at all, but might be, or you might have a very complicated case.
Mhm.
And I am doing, just in case in point, there's me. I've got
Yeah.
babesiosis, Bartonella, and chronic Lyme, and I'm dealing with babesiosis right now, traditionally, and also with some herbs. But I'm just wondering if you have any collaborative agreements with like traditional, like Lyme literate medical doctors.
Yeah, I do. I'm always open to collaborating and working with other providers, and I'm happy to do that. Sometimes it's sharing notes. Kind of depends on what they want to do and what they're open to. Like some Lyme literate doctors are like, "You're only seeing me. You can't work with anybody else," which I understand, but I also think like we all have our limitations and things that we're good at, things we're not good at. But yes, I do that often, collaborating with primary care doctors or with specialist Lyme literate doctors. And sometimes, like I said, it can just be sharing chart notes. Sometimes it's a phone conversation. Yeah,
Yeah,
definitely.
I mean, the other thing is that a lot of times are you not like practicing in the blind since most people are not adequately tested for the tick-borne co-infections? Do you feel like that, does that like hinder you in terms of what you're doing? Or do the labs matter to you or?
Yeah, I put a grain of salt with the labs, just because they're not, you know, they're not always reliable. I tend to look, I tend to could do a combination. I like to see the labs. Some people can't afford the more expensive labs, like the, Igenix and so
Hygienics.
forth. Yeah, and the other ones, the Galaxy, there's like, and I think now, anyways, there's like, we always new labs like offering like one of the labs I use for environmental medicine, Mosaic Labs. They're now offering different kinds of like Lyme tests, but not a full panel. Anyways, there's a lot. Yeah, there's like a lot of different labs out there, and not everybody can afford them. So ideally, it's nice when people get the test, can get the more expensive tests, and
Well, I
then
mean,
it's
yeah,
more clear because sometimes that's more helpful for the patient. Like we lost somebody there. To see what it is. But I do testing like through, even sometimes like if somebody can only afford Quest and LabCorp, we still do it. But then I'm like, well, to me, you clearly have the symptoms of Babesia or Bartonella, and then sometimes we'll do a trial run with herbs, not necessarily the antibiotics, but sometimes we'll do a trial run with something to see like, okay, well, you had an improvement in that, then let's go ahead and treat this. And then a lot of times the benefit with the herbs is there's like a lot of cross treatment. So, for example, what was it like Chinese skull? I think it's Chinese skull cup and cat's claw and knotweed. They both treat Lyme and Bartonella, and cryptoleptis, which is an amazingly fabulous herb. Also treats a lot of, which has now been found in recent studies to be actually a better treatment than doxycycline in culture, not in real people, but in
right.
the cultures they found that that also is like broad acting and treats a lot of different, treats Bartonella and Babesia. So sometimes that's the benefit of that, is sometimes we just try a treatment and it's like, okay, yeah, you are improving. Let's keep going down that path or do the testing.
Yeah, I mean, it seems like there is a lot of trial and error. With like, well, is it the Babesia? Is it Bartonella? Is it the Lyme?
Yeah. Yeah.
Especially if you have, two active ones and you can't do a traditional treatment for both of them at the same time
Right.
necessarily. What I've found is people want to go with the Babesia first and then add. But anyways, I'm just looking for complementary care, or just,
Yeah.
in collaborative care.
Yeah. Well, I'm going to share at the end how you can book a free 15-minute consult on my website, and I'll show that up if you stay towards the end, or I think Maria will share it also. But yeah, we can talk further to see if we could work together.
Mhm.
It looks like there's Ellen has a question.
Yeah. Go ahead, Ellen. You can unmute.
Yeah, I hope you don't mind that I'm staying off camera. I'm doing what I call like my little line nap. So I'm lying down, and I
Oh,
want
that's fine.
to.
We can't see you. I don't think your camera's on anyways.
Yeah, that's it. I also want to be full disclosure. I did start working with Dr. Nitya about 6 months ago, maybe not that long ago, but I find it for me a really good approach. I was dealing with believe it or not, a DO who, like many of us, all of a sudden started gaslighting me on the line. because my tests weren't positive. Um, I'd done the basic stuff that, as most of us know, it's 50 to 60% false negative. And that's a lot. That's like more than, at least that's the numbers I got from Lyme Action Center, a lot of other places. So I just wanted to say that my experience has been really positive because for me, I've worked with other naturopaths in the past and also with Dr. Nitya. What's kind of cool is it's not just, some herbs and homeopathy, but it's a whole thing. It's things like, dealer's broth and various exercises and various this and various that. And, hot and cold, naturopathic kind of treatments, like with water and things like that. So that's been positive for me. But I did have a question for you, Dr. Nitya, and other folks who are dealing with Lyme. I've recently lost another tooth, and I have found that since I've had Lyme, I've lost several teeth. There's some inflammation. My teeth were not perfect before, but I wasn't like literally losing teeth. And so, like the other day, I, went online and I looked at this, and other people have been asking, oh, so is it common for people with Lyme to lose teeth? Another thing I wanted to comment on that happens with Lyme. I went to another Lyme clinic. They couldn't get my blood in a blood test. And like they tried for like an hour. And these guys were like nurses, like they're used to doing blood draws. And I'm like, does this happen often? And they're like, yeah, about 25% in their clinic. I'm wondering if you could comment on those two things. Not being able to do blood draws and also, teeth and gum issues. As to me, the way I look at Lyme is it just kind of exacerbates everything. If you used to get hangnails, now you got 20 of them, that kind of thing. It's like if you used to have some gut issues, now it's like, 10 times worse. So I'm just wondering if you could just comment about that in general.
Yeah. Yeah, sure. Thanks, Ellen. Thanks for being here. Yeah, I would say what comes to word that comes to mind is just collagen, and then also mineral deficiencies. I think about that with losing teeth. And yeah, there's also like the collagen, the connective tissue that's holding up the teeth themselves, that I think it just manifests in different ways. Like you're saying, like for some people, maybe they get more of like the joint pain or like inflammatory arthritis, or anything like that. But I think, yeah, I have seen some people that just start losing more teeth or having more dental problems. And it could be because we're learning more now about that there is an oral microbiome, not just a gut microbiome, but an oral microbiome also. And so sometimes someone might already have certain bacteria that were already off in the oral microbiome, and then the Lyme or the antibiotics or both, either of them could kind of set that chain reaction off, and then there can be like more inflammation, causing some of the collagen to break apart, causing some of the teeth to fall apart, or break off or lose teeth. Sometimes we see that like in the nails a lot. Do you see that in the gums, like a more gingivitis? Sometimes that's because the hormones are also thrown off, like if like the cortisol levels are off from the stress and the inflammation of the Lyme itself, or they're just, the stress of the disease too can cause that. And then there's more cortisol, more inflammation that could just go to that area for different people.
The is really
and what
that you're mentioning there, because I will say, I started hearing about that in various support groups, and this is where you also learn a lot, because it's like when you go to those support groups, you just hear other people's experiences, and you're like, oh, yeah, I'm dealing with that too. And my hormones were very much thrown off this year. And, usually, like we say, we subscribe it to other things, but then when you put this thing that is really taking over so much of our bodies, you know what I mean? It just like, it makes sense that it's going to affect so many different systems.
Mm-hmm. Yeah, and you had another, what was the other part of your question?
Liz had a question.
Okay.
I do. Um, well, first I'll say I was lucky enough to have a primary care doctor who was a naturopath who trained at Bastyr when I lived in Seattle, and I wish it were possible for everybody. Um, because I don't have that possibility, I have a question about um, well, the immune system and testing.
Mhm.
I have had pulled ticks off of me in probably 10 different states in the last 20 years, and I didn't know about tick-borne disease. I ended up in the ER after a tick problem in 2008. I was traveling and I wasn't tested. I was given a week of doxycycline and I developed C. diff and then
Mm.
was POTS, although I didn't know it. And then a few years down the road, I got a vaccine that made me deathly ill. I got flu shots every year, but all of a sudden, no. And then I developed mast cell activation syndrome and
Mhm.
finally immunodeficiency. And
Mhm.
I have an immunologist who thinks the whole whoop-de-doo about Lyme is just that it's kind of a fad along the lines of, I don't know what, like everybody thought they had hypoglycemia or something. But I did convince her to test me. She did a Western blot. She tested me for anaplasmosis by PCR. And I think Ehrlichia as well. I
Mhm.
I have B cell deficiencies and T cell deficiencies. Am
Mhm.
I going to be able to, I mean, how accurate is testing for such things if your immune system is limping?
Yeah, you might not create like a strong immune response, which means you might not have a very positive test. I think in the case like that, you would probably like you might have to test with like IGenics or some of the more if you can, some of the more sensitive tests. Or if not, I would say like probably if if you had a tick bite and then you got sick, I don't rely. I mean, in terms of the labs, I don't like if it's acute Lyme. I don't rely really on the labs because usually by the time you do, it's too late, anyways, right? So it's like if you knew you got bit by a tick and then you have symptoms, you got to get the treatment right away. Um, in your case, it'd be a question of like what you'd be able to tolerate, and you might produce different because you're immune deficient. You're going to not produce like classical Lyme symptoms. Like I'm guessing you don't get like fevers and sick
That
like that, like other people do. You might just kind of get more of your chronic symptoms or something like that. But yeah, it would be kind of like working with a Lyme literate ND or MD or primary care that can help you kind of navigate all of that.
is the idea I got is that a PCR test, since I don't know, is that like measuring DNA tidbits or RNA or something? I'm not sure. Anyway, she seemed to think that it, that was the be all and end all. It's like if that's negative,
Um,
you're
no,
oh,
yeah, no, unfortunately not. So it really depends. The PCR test is more effective like in the first, I forget if it's like 7 to 10 days, like after a tick
oh,
bite.
oh,
It's something like that. But then once it's like past that, though, that's where we kind of start using more of the Western blots and things like that. Um, but again, like I worked in primary care for 3 years, and I never waited. If someone told me they went on a hike and then they got this horrible rash and they're laying on the floor and they're nauseous and like it's just like classical Lyme symptoms, and they're like, "Oh, I just hurt myself." I'm like, "No, you have Lyme. Like take and then we get them the doxycycline and the probiotics and all the other herbs and supplements, and then like within like 24 hours, they're like, "Oh, they're not all better, but they're starting to feel better." It's not like for acute cases. I think we
so
can't.
it's possible then that I mean, I sort of was on a plateau, only sort of gradually going downhill, and in the last 4 or 5 months, I've really gone down the tubes. And I've made the round to all pertinent specialists who say, nope, next door, like,
Yeah, right. That's always frustrating.
yeah,
Yeah. Oh, you're talking. Yeah. I mean, when you have a really complicated case like you do, I mean, yeah, it's not. You're probably not. You probably do need like a naturopath or a,
yeah.
more holistic MD or
But that it
something,
doesn't mean
functional MD.
it doesn't necessarily mean that because those tests were negative, that there's nothing to pursue in the tick-borne world.
Not necessarily, but we also don't want to only say that everything is Lyme, right? We don't want to do that either. So we also
Okay.
kind of want to have our, because we don't want to just go down one rabbit hole or the other, because it sounds like you have a lot of different things going on. And, I would be curious about what's going on with the mast cell and if that's being addressed, and I would want to look at like kind of like treating your immune system with kind of herbs, supplements, hydrotherapy, other things, sauna. Like, I'm not saying you can do all these things, but those are just examples. Like, I would want to sort of look at like, okay, what can we do to like try to heal and boost the immune system while we're figuring out like, okay, is it from the mast cell activation, or is there a new case, or is there Lyme that's still going on, or mold, or what is it? You're trying to figure out the cause, but there could be a couple different things.
Yeah. Okay.
Yeah.
Thank you.
Yeah. And
We have
I
some.
just have to
Oh, go ahead.
I'll be right back. I forgot my I gotta grab my computer, my plug. I'll be right back.
Okay. We'll pause for just a moment. Lisa, we'll get to your question, and Ellen also will get to your question. Carl, welcome.
Thank you. I'm sorry for being late. I was having trouble with my Wi-Fi.
No worries. We're
Yeah.
recording, and if you have some questions for Nitya, you can type them in the chat, or you
Okay.
can raise your hand. I've got two people ahead of you who are
Okay.
also
Okay.
asking questions.
That's
And
good.
just so everybody knows, this week at the Lyme Center, we have a meditation on Thursday, the 30th at 6:30 p.m. And you can register for that on our website. We also have a support group, Lyme support group, Saturday afternoon. That starts at 1 p.m. Eastern Time. And coming up in November, there's a book chat, and that's with one of our volunteers, Linda. And that will be at 12 p.m. lunchtime book chat. And you can read all about it again on our events section on the website. The next support group in November is the third Wednesday, and that's chronic illness group, and that starts at 4:30 p.m. So all of these things are on the website. If you'd like to check that out and register for any of the events, everyone's welcome. Welcome back, Nitya.
Yeah, thanks. Sorry.
We have a question from Lisa, and she's asking about acute treatment and prevention.
Yeah, it's looking at the question. Is it okay if I read it out loud?
Yes, that's fine.
Okay. So it says, can you discuss how you treat a tick bite? I don't feel to dose doxy. Oh, you get like 2 caps of doxycycline. What herbs would you use after tick bite engorge versus not engorge? How long does the tick need to be attached? Can you talk about tick bite prevention in general? Yeah, so that's kind of like a whole talk there, but any new types of preventative herbal sprays. So yeah, the sort of like prophylaxis, the doxyprophylactic treatment, I usually don't recommend that. I feel like it creates more antibiotic resistance and doesn't really work. I feel like it works with people if people aren't going to do herbs, and probably better than not doing anything. But I think there's better things that we can do. typically, if there's not really like a time usually. I mean, I've seen Lyme being transmitted from a tick being on for 8 hours, so it's not like it has to be 24 hours or 36 hours, especially like a lot of that's changing, like there's just the ticks are carrying more and the bacteria, I think, are just more virulent, right? Like they're smarter at getting around the antibiotics in our immune system and all of that stuff. So typically for most tick bites that we know are the deer tick bites, because the deer tick bites in general, well, we're talking like northeast. If we're talking northeast, the deer tick bites carry the most disease. But the Lone Star tick and the dog tick do carry a lot of other pathogens as well, especially if we're talking about like central US or even like Pennsylvania. And the Lone Star tick is like coming up to Maine as well. So those ones, the pathogens can be transmitted pretty quickly. So I usually say if it's like a deer tick and you're you're confident that's a deer tick. I used to think when I moved to a new town, we have all these dog ticks on our land. And so it took me a while to like learn what the female dog ticks look like, because they look kind of similar to the deer ticks. So if we know it's just a deer tick, I usually always say save the ticks. Don't just pull them off and throw them out or whatever, but put them in a little bag, put them in the freezer, label date, location, like you found it on your arm, what the date was. And then that way, like if you have any symptoms, you can send the tick in to get tested, because that's the most accurate. That's more accurate than like waiting, and better than waiting 4 to 6 weeks and then testing the blood. And then I usually, so I have an herbal and homeopathic protocol that I have folks follow. So I have a tick kit and it has all those things in it. I usually recommend three homeopathic remedies and the tincture, and it's an alcohol tincture or a glycerin for people that can't do the alcohol. And the herbs are like knotweed, smilax, Japanese knotweed, smilax, andrographis. What's the other ones that are in there? I'm forgetting all the cat's claw, and astragalus to help boost the immune system. And I usually have people do that for 6 months. If it was like on for a deer tick and it was on for a long period of time. Like my daughter last year we would like come home with like dog ticks in her all the time, and there was maybe like one deer tick. So it's like I'm saving all those ticks, but I'm not testing all of them. And I'm not necessarily, I usually always do the herbs and the homeopathic treatment to get it started. I don't always do the full treatment if it's not a deer tick. And then the cryptoleptis, I think I mentioned before. So there's like a new study by Johns Hopkins, and this was just doing like Petri dish. It was just testing and it was just testing Borrelia. It wasn't testing all the co-infections. But it was looking in the cells, the spirochetes themselves, and then culturing them out. Like it was like, I think they did, let me see if I can pull it up, because I think it was doxycycline, cryptoleptis, and then there was one more thing they did. And the crypto, I don't remember the other herb. Let me see if I have it, because I was just looking at it. So, so cryptoleptis, which is an African herb, it's used a lot for sepsis and very serious infections. So now where there's like a lot more information about using it for Lyme and Babesia and things like that. So it actually, a 1%, which we use much more than a 1% extract, but a 1% extract caused complete eradication of the BB, the Borrelia burgdorferi, while it was testing 2 antibiotics. It was doxycycline and cefuroxamine, and other active herbs could not eradicate the stationary phase cells. And those are the Borrelia cells that are basically, they're not like, when you first get Lyme, they're like active and multiplying. And then there's like get into the more stationary phase where it's harder to treat, and they kind of, they go into the tissues more. But the cryptoleptis was actually able to eradicate it after a 21-day culture. So that's pretty cool. So we're learning a lot more. And so I have had some patients that are just doing the cryptoleptis, but you would need to do it for a while. It's and I don't know about other types of I'm trying to think of sprays. I think different people you kind of have to find the preventative approach that works for you. Like someone else was mentioning, they're on a farm and they just get ticks on them all the time. Some people work really well with neem oil. Some people have like a natural tendency to like not get bitten, and some people get bit more. Sometimes, you have to cut your hair. Sometimes there's a lot of different strategies, but you kind of have to find the one that works for you. I feel like wormwood and sweet anise work really well. Oregano oil works well. Neem oil with NEEM. It's an Ayurvedic oil. It's a nut that works really well.
Cedar?
Yeah, cedar works really well. But a lot of times you can spray yourself all over, but then you still can get tick bites, right? So there's not really there's not something that's like equal that I found anyway, that's sort of equal to like a DEET or something. And I don't always want people doing that. I think kind of learning about where to go and not to go at certain times of year, and then finding different practices, like checking yourself twice a day and making sure when you come inside, you take off all the clothes right away. Like a lot of times the ticks went up in the clothes, even if you do a tick check. So having a good strategy for that, throwing them in the dryer for 5 minutes, whatever it is. And making sure, like with my daughter, I have to, sit her down and then get the headlamp out and like look through all of her hair every night. But, can you do that if you don't have a partner that you can do that with using, there are lots of ways to like hang up mirrors so you can see, the back of your head and all of that. And some people will just cut their hair that time of year too. So, yeah.
Thank you. Thank you. That was very informative.
You're welcome. And then,
Ellen has a question about PICC lines and how antibiotics affect the gut.
Yeah. So, it's really more systemic with the IV antibiotics. What is that? I find the oral antibiotics very difficult to tolerate because I was given so many as a child. Yeah, the IV antibiotics. I find I don't have that many patients that I'm seeing that are on the IV antibiotics really anymore, just because I don't really use that strategy. And I have had some patients, and I find it's just some people, it's really hard for them to get off of the IV antibiotics. And then some people also just can't tolerate them. Like I just see a lot of gallbladder issues arising or liver issues. And it's usually just it does affect the gut microbiome, of course, but it's really kind of affecting the whole body. And then usually people can only tolerate them for so long, is what I found. I did have I've had one patient who she was like, she couldn't get off them, but she was also sort of just more scared to get off them. And it was, it was sort of keeping her alive at the time. It was like a more complicated case of someone who had Lyme since she was a child, and she was, young adult at that point, maybe 18 or 19. And so she was also scared to try to get off of them. And her Lyme litter doctor didn't want her to get off of them. And then we worked together. It was another naturopathic doctor in my office that was also working with her, and she was doing like IV out. She was doing ozone, and I don't remember everything that she was doing. She was doing a lot of different treatments, but I don't remember all of the systemic issues that she developed, but that's usually just what I see more, is just more inflammation and intolerance at some point. I don't know if anybody else has more experience with that.
Carl has a question about success in treating Lyme going back as far as 20 years.
Like there's been Lyme for 20 years.
Yeah, his question is, have you seen success treating Lyme that goes back as far as 20 years? I'm convinced that I'm still dealing with Lyme that started in 2003. In the last 2 years, I've been treated with both antibiotics and herbal AL complex without success.
Mm-hmm. Yeah, well, I mean, it's hard to say without knowing all the details, but yeah, definitely in general, the longer you have the Lyme, the harder, and it's kind of gone untreated and undiagnosed, the harder it is to treat it, just because there's often a lot of inflammation and damage that's been done. It's not like impossible to recover from it, but kind of at that point, it's a little bit more. Sometimes, you have to also identify, and it's not always clear, like, do we need to treat the Lyme or the co-infection, the pathogen, or do we need to, let's say like it really affected your brain or something, or affected your joints, and now there's like a lot of arthritis, like, we need to also, help the joints or help the brain to recover as much as possible. There's probably a lot of like nutrient mineral deficiencies, and things like that. And then if you've been sick for that long, it's going to take a while. Like, you think about, like, it could take 20 years to get better, right? Because if you've been sick for that long, we say like at least 1 year of treatment to recover from Lyme. But really, in a case like that, there's probably so many different things going on and so many different layers of things that need to be worked on and recovered from. Like, there's probably a lot that needs to be done to support the adrenal glands, hormones. There's a lot that needs to be done with the gut, and all of those things could take 3 to 9 months just to do, like, what kind of working through all the body systems. And as I was mentioning, I'm not sure if you were here before, that person was here before, but just that we're kind of also looking at, like, not just treating the pathogens, but treating like the systems and facilitating healing. And I do think it is possible, but we also, have to look at, like, well, that's been going on for that long. What's possible? Like, is it? And sometimes it's hard to say. It's hard to know. Like, I don't want to give false hope, but I also don't want to say, like, oh, it's not possible to heal from that. But then sometimes, it's like, if we're looking at like an X-ray of the knee and there's just already like so much arthritis and there's no knee left or something like that you need knee surgery. That's just one example. But then it's like you can only do so much to recover something in that situation. Like, if you but I do still think that it is possible, and there's a lot that can be done. But sometimes it's more of, maybe not completely like getting rid of the Lyme, but learning to like live with it so that you can have a full life and kind of like, meet your goals and be as healthy as that you can be, and and having like a balance of everything. Does that make sense?
Grief is a topic that comes up often in our groups.
Yeah. Yeah, definitely.
Now, I have a question. Are there herbs that you shouldn't take long term to do with modulating the symptoms?
Yeah. I mean, a lot of the really strong antimicrobial or antibiotic herbs you don't want to take. I mean, definitely, like, when we think of Artemisia, like anything in the Artemisia family, like the wormwood or the sweet anise, those can cause liver issues if just taken continuously. Those are the ones we use a lot for Babesia. And so, yeah, those you need to be pulsing and like monitoring liver enzymes and things like that. And yeah, there's a lot of herbs. Like I mentioned, the product for the gut, the biocidin, that has like golden seal. I feel like a lot of the things like wormwood, golden seal, black walnut, Those are pretty strong, and essential oils too, like oregano oil and things like that. I think in general, it's good to like move things around. This is not necessarily like a damage thing, but or causing problems, but I think in general, it's good for the pathogens to keep moving stuff around and changing stuff. But those are the main herbs that I think of. Cryptolepis, I'm still learning about. I'm not sure the limitations of that one, but I know it's being used safely in children. I don't know the limit of it though, like how long you can stop. But a lot of these herbs, like I've had patients take like that basic Lyme formula that I was mentioning in the beginning for tick bites, like people do that for 6 months. I've had people do that for a year. I mean, sometimes we'll take breaks because people run out of their herbs and they don't get them refilled right away. And that's sort of also like a good way to take a break and then come back. But a lot of those are safe to take even up to a year. But some of them aren't. That's true.
Someone's asking if they can purchase the tick bite kits that you had mentioned.
Yeah. Yeah. So I could either do this now or later. You can send me an email or you can, yeah, that's probably you can send me an email or call me to order a ticket. I don't have a page on my website that you can order it from, but that's the easiest way to do that. And it comes with 3 homeopathic remedies. Comes with Ledum that you do on day 1, Hypericum you do on day 2, and then a nosode, which is a dilution of basically all the different things that you can get from a tick. So it's giving your immune system all the information to have a good, strong immune response. And that has the herbs in it and my protocol that tells you how to take everything in it. And it can be mailed to people as well. But if you want to order it, that you can email or call to do that.
Maybe you can give people a little bit of information on the difference between homeopathic medications and the herbal medications.
Yeah, so herbal medicine, most people are familiar with, even just in like crushing up garlic and putting in your food. So herbs are like what we call the crude extracts of something. So it's like usually like, mint or something or chamomile that you make into a tea, or you extract it into alcohol or glycerin, vegetable glycerin, and steep it for 4 to 8 weeks, and then take it out of the menstruum is the liquid that it's sitting in, and then what's left is the extract, and then those are often combined with other things. And then the homeopathic medicines are basically dilutions of all kinds of different natural substances. So they're made from minerals, plants, animals, and homeopathic medicine is kind of what gave us like clinical trial. It's like what we did in homeopathic medicine in the beginning is kind of what gave us like clinical trials and vaccines and a lot of things that we use in conventional medicine. And the difference is, so the Ledum that I use is to prevent the infection from getting deep into the body. It helps it stay what we call more superficial. And so it doesn't get to help prevent it getting into like the nervous system and staying kind of in the bloodstream and the immune system so it can deal with it and get it out. And then the Hypericum, which is St. John's wort, it's basically instead of it taking like a St. John's wort tea or a tincture, it's actually a homeopathic preparation of that, a dilution. And when it's diluted, it actually makes it more, it's called potentized. It actually makes it stronger. And then it has the opposite effect of what it would have if you take it, like take St. John's wort for depression. Then if somebody has, like or like poison ivy is a good example. It's like when you get poison ivy rubbed against you, right, you get the rash and all that. So then if somebody who has a rash, you might give them a dilution, a homeopathic preparation to treat that. That's kind of the best way to explain that. And anyway, so then the Hypericum, the St. John's wort, is used to prevent neurological issues. And then the nosode is kind of like to help the immune system give a little bit of information from all the different pathogens that you can get from a tick. And it's been diluted down, and there's nothing physiological that you can test in the homeopathic preparations. Does that make sense?
Thank you.
Yeah. And I've just found that doing the comment, some people just do one or the other. And I found that the combination works really well. And I've had good feedback from my patients. And that's why I've been using this ticket with these protocols for like 7 or 8 years. And most people that are getting it, even if they were sick, they didn't stay sick. So, and you can use them safely along with antibiotics as well. Oh, and I will say that's the other quick thing that I will say is that is also a benefit of using a lot of the herbs, the anti-spirochetal herbs and the antimicrobial herbs, is that they help decrease toxicity, but they also, like we know, Chinese skullcap helps doxycycline work better. And I think they were seeing that with cryptolepis as well. And then there's other herbs too, but like some of the herbs I have in my Lyme formula help prevent like liver issues that can develop for some people. And I never see C. diff in my clinic or the clinics I've worked in, because we always give people probiotics with antibiotics, like good strong probiotics. So you don't have to get C. diff forever that way.
There's been a bit of a side conversation about prevention in the yard. And one of the people were talking about permethrin and how some people can't tolerate that we're so sensitive. And some of the alternatives, again, turning to cedar, there's a product called Cedar Side. And there was some discussion about that. Do you have any comments on prevention in the garden, in the yard?
Yeah, I mean, I think really raking the leaves or having somebody else do it or blowing the leaves or paying somebody to do that, or getting your neighbor to do it, whatever. The leaf blowers are really helpful. Just removing their habitats, as much as possible. Like trying to make a safe outdoor space is really important. Some people, there's sometimes like tick nest in different areas, and I know there are some companies that are now spraying like oregano oil and like wormwood oil and cedar oil and things like that, so that you don't have to get the permethrin. There are some companies, I don't remember the names of them right now, but I've seen them around. And so sometimes that can be really helpful for some people. Some people can do the permethrin tubes and place them around the garden, but that's kind of harder if you have young children and pets and things like that. And there are some herbs that are helpful to have around the perimeter, such as all different kinds of like wormwood, like things in the Artemisia family. So like southernwood and wormwood, sweet Annie. I think that all really helps. And then just kind of keeping up with cutting things down, keeping things short, as well as sometimes I've used diatomaceous earth. Like I know some people, there's different opinions about that in the garden, because they also keep away some of the beneficial insects as well. But sometimes it's helpful just to do like around, like in my backyard, there's like the porch, and then we have like plants, and the backyard is kind of right at the bottom of the steps, basically, of the porch. So we put diatomaceous earth just kind of in that area to like prevent the ticks from climbing up onto the porch. But there's some, like, I know there's a lot of old houses around, and I know people tell me like old houses in Vermont and the farmhouses and things like that, where the ticks just crawl into the house too. So, and then I think getting the pets treated, and then just you have to check them a lot, because sometimes when you're getting your pets treated, then they bring the ticks in. So you have to also check the pets as well.
Ellen has a question.
I'm going to say white, short-haired dogs versus,
Yeah.
and it's so sad. I know that, we should be now taking up the leaves, which is like such a good gardening practice. So it's hard to, but I hear you. I had forgotten to ask, when you were talking about the ozone and some clinics do like vitamin C IV and other immune, system IVs. And I'm just kind of wondering, besides the antibiotic IV, what you think about those in general.
Mhm. Yeah, so I worked in the clinic I worked in Brattleboro, Vermont, Windhorse Naturopathic Clinic. I was in charge of the IVs. I thought ozone for a while. We had a phlebotomist who did them, but then I was kind of the doctor in charge of those. And some people, eventually the doctor there stopped using ozone therapy because she felt like it wasn't it wasn't as if it wasn't really as effective for Lyme as it was hyped up to be, I guess. But yeah, I think what I found with the ozone is that it would be like helpful for people temporarily, but it didn't really. And this was in a naturopathic clinic where people were doing a lot of different things, so nobody was only doing the IV ozone. But it just seemed like people were spending a lot of money and they weren't really getting like long lasting benefits from it. I think some people did, but people who were sick for like a long period of time, I don't think we really saw any long lasting results. And I would say most people felt improvement, especially with like fatigue or any respiratory or like heart symptoms, but and sometimes with pain. But again, I feel like at some point, for some people, they would just cut back. The IV vitamin C is great for, if people, for when there's a lot of immune deficiency or when we identify like chronic viruses. I think it's more helpful for the viruses and like for chronic fatigue that seems like it's more viral in nature, or when there's like somebody has Epstein-Barr or they have that in their history. It does help a lot with the fatigue and long COVID symptoms. Yeah. Herpes, things like that, and cancer. But I don't really I haven't worked in clinics that have been using it for cancer, but some people do use it for that, and that's a whole other thing. But it does help with immune boosting. So sometimes even people with like immune deficiency and mast cell issues, IV vitamin C can be really helpful.
Thank you.
Yeah.
More questions? Anybody who came late, you're welcome to type in your questions in the chat. So, are there any other herbs that we haven't mentioned that would be helpful and supportive that you commonly prescribe?
So many. It's hard to
Something foundational.
Yeah, let's see. I'm trying to think of like the ones that so something that I use, I'm just trying to think like, what do I use with most of my, Lyme patients? What formulas do I use? So besides just like the herbs that are treating infections, I usually use a liver formula with people at some point. That usually always comes up, whether it's from the treatment or from either from antibiotics or from the Lyme disease itself. We can see the liver getting affected a lot by Lyme and co-infections. So my Lyme formula has milk thistle. Milk thistle is like one of the best herbs for healing and recovering from like liver toxicity and liver damage. And there was a patient I mentioned before where I was saying I did like a listening to her organs, and I felt like her liver wasn't right, and then she had like liver damage. or sorry, high liver enzymes that showed up on her labs like later on. So we use a lot of milk thistle with her, and they brought the liver enzymes down pretty quickly. So it helps to restore the liver. It can be used alongside NAC and acetylcysteine. It used to be used for like Tylenol toxicity in the ER. So it's a really great herb. And then I usually also has burdock in there, which helps with the lymph. And often when there's often like a stagnant lymph, our lymph is like that's where our immune system lives. Not only in our lymph nodes, but we have like these channels throughout the whole body. And the only thing that really moves the lymph is exercise. And there are some herbs that help to clean and move the lymph as well. And burdock is one of them, which is also really great for the liver. And what else is in there? Dandelion root, dandelion leaf, which is also for lymph and liver. And then cordyceps, which is a fungus, a parasite that lives on a fungus, actually. And it's a Tibetan herb, but it's really great for like energy and liver issues. That's kind of another formula that I often use with people. And I mean, there's a lot of other herbs for, I think someone was asking like about Bartonella and Babesia herbs. Hutinia is another like immunomodulator. So immunomodulators, they don't just like boost the immune system, but they help to balance the immune system. So sometimes it's too like not working well enough or it's working too much. So it helps to kind of balance that out. That's used a lot for Bartonella and Mycoplasma. And we talked about Artemisia and Sweet Annie. That's the herb that's used a lot for Babesia because it was used for malaria in the world. And what other?
What about elevated cholesterol or thyroid issues? Do you see that in conjunction with chronic infections?
Yeah, definitely thyroid for sure. Definitely, usually more on like the lower end, like hypothyroid, where their thyroid gets really tired. I usually see like either a combination of like low adrenal function and thyroids, and there's like a triangle between like your adrenal glands, your thyroid. It's really kind of, they make it a triangle, but it's thyroid, adrenal glands, and then we call the HPA axis, the hypothalamic pituitary axis in the brain. And that's like the part of the brain that tells your thyroid to make more thyroid hormone. And so your adrenal glands, if there's Lyme, if there's like just a constant infection going on, your adrenal glands are constantly being stimulated to like make more cortisol. That's what inflammation does, and that gives you the fight and flight response, which is why people often have like the surges of energy and anxiety and palpitations and all kinds of things like that. Or just like, on the other end, it can crash and go the other way too, of like fatigue and stuff. But then when that kind of gets run out, then that can then your thyroid can get drained if you're just like stimulating your adrenal gland all the time. And so we see that happening a lot where your thyroid is low. And that's also, so I'm always looking at like other glands and what else needs to be addressed. Typically for low thyroid, depending on how low it is, like sometimes if it's like really, really bad, we might need to do the medication, might need to do like a thyroid medication. In terms of herbs, usually I'm doing combination formulas that have like ashwagandha, schizandra berry, tyrosine is a nutrient, and then like selenium, iodine, depending on if there's Hashimoto's or not. And Hashimoto's is like the autoimmune variant. But a lot of times we're doing a lot of herbs to have balance the immune system when there's autoimmunity going on. And that's kind of also when we have like the long-term Lyme stuff going on, there might not be an active infection going on. There can be autoimmunity. There can be other things too, heavy metals, environmental toxins that need to be dealt with. In terms of like cholesterol, I mean, I feel like with Lyme, it can just, it's just a lot of inflammation, especially when there's a lot of gut inflammation. I definitely see, and liver issues, I see the blood pressure going off and getting really high or really low with like POTS or not, or just low blood pressure or too high. And then, yeah, sometimes the cholesterol gets thrown in there too because of that's coming from too much inflammation. And usually cholesterol, we have to kind of look a little bit more at like diet. I mean, a lot of times we'll use garlic and like liver herbs for that, or artichoke and things like that. But then we also have to look at like what else we have to treat the inflammation. So like turmeric and other things for the inflammation, knotweed and whatnot.
Thank you.
Yeah. And then there's a lot of different herbs that I use to kind of support when there's, like I said, when there's a lot of neuroinflammation, that can cause any kind of neurological symptoms, but they can also go into like the mood stuff and into even like mental health symptoms. So often they're from the neuroinflammation. So doing things like frankincense, which is also called boswellia, is really helpful, or propolis, turmeric, Lutein is another one, and also the Chinese skull cap is also helpful for the neuroinflammation. So that's why I'm saying like a lot of these herbs do so many different things. So there's a lot of cross purposes, and then also use a lot of nervines with people. So those are things that help to kind of bring calm and balance, and help. We didn't talk about sleep, but help have a deeper sleep too, which is also really common. We see either like too much sleep or not enough sleep issues, and Lyme is super common. So nervines, whether they're really gentle ones like chamomile and lavender, sometimes I use like an essential oil of lavender internally with people, and there's like a lot of panic. And then I'll even like, sometimes we're using like passion flower, ashwagandha, tulsi, and I have a formula that has a lot of those things in there together. And then motherwort, which is a herb that's used for pain, anxiety, and like menstrual issues. And then it's also really good for like palpitations. So sometimes if we're seeing just sort of nervous, like heart issues that are coming more from the nervous system, then those kind of herbs can be helpful too. And the motherwort is really helpful for that.
One final question, and it's a little complex, from Kurat. He says, I've been on antibiotic treatment for the 3Bs for 6 years, inclusive of a litany of supplements and several nutramatic herb drops. My doctor's tried several times to pulse off antibiotics and onto various herbs. Each time I've had severe neurological flares that force me back on the antibiotics. Any suggestions to try and get off the antibiotics?
That might be where I use more of like what I call like a constitutional homeopathic approach, where we like spend 90 minutes and then taking your case and trying to go through all the different symptoms. And in that case, the homeopathy can kind of really help to reset the nervous system and help it to heal. Probably I would want to look at like all the, like I would want to look at and make sure that there's a lot of herbs and nutrients in there for the neurological inflammation. And sometimes that's tricky. It's hard to get at that. And like I said, sometimes those are the herbs that like maybe it would be like turmeric or boswellia, for example, something like that. Doing that for 6 months or something, because the nervous system takes a while to penetrate those herbs, or even like CBD, things like this that are, we know, kind of penetrate into the nervous system. And looking at some things from an Ayurvedic medicine perspective, where you might need to do like a combination of those herbs plus gotu kola and brahmi and what's the other one? Forgetting the other name of the other herb. But lion's mane, mushrooms, and then also kind of like, doing like ketogenic diet and like lots of healthy fats to kind of really bring down the neuroinflammation for like a while before trying to get off of anything. And then potentially, like, I don't know all the details of everything, but then potentially also replacing, like usually when I like to see people get better before taking something away. And it is. Sometimes it's really tricky to get off of the antibiotics. But I would try some other, I would probably try a combination of some of those things for a while before trying to get off again. And then also think about like replacing, and maybe trying some other antimicrobial herbs, kind of in addition to ones that are for the neurological inflammation. And then sometimes doing other modalities too, like craniosacral therapy, like ones that are, or like neurological or neurochiropractor, like something that's like a specific type of body work to kind of help heal some of the nerve system neurological pathways. Because sometimes what happens with if there's like, I don't know if this is peripheral or central, but if there's like central nervous system where you're talking about like brain and spinal cord, like with pain, it's like your body just starts, like when you get into chronic neurological things like chronic pain, whatever it's from, your body just just keeps making the pathways over and over again. And it's really hard to like stop it. It's like trying to stop like a moving train, going like really, really fast. And so that's where the neuroplasticity comes into, like what's that program? The Primal Trust, I think it's called Primal Trust program, that I have a lot of my chronic illness patients. It's specifically neuroplasticity program and somatic training and nervous system healing for chronic patients with chronic illness. So I would say kind of doing that along, or doing some kind of modality like the ones I mentioned, like to help some kind of body work to help heal the nervous system first. So hopefully that's some new ideas.
Are you able to take one last question?
Yeah.
Carl asks, are you familiar with the use of the nicotine patch for treatment of symptoms like joint pain? Is this a legitimate treatment?
No, I haven't heard of that. For joint pain in general, or for joint pain from Lyme?
I'm going to speak up. It's related to my Lyme symptoms. I'm some of joint pain, and there are other symptoms as well. And the nurse practitioner that I've been seeing suggested trying that, and I've been haven't, but it's something that she was suggesting.
I can offer a couple of thoughts. I actually was at my Lyme doc this week, and she brought this same issue up of nicotine patch, low dose, like low
Yes.
LDN, low dose naltrexone is another treatment that is prescribed for. For me, it was about brain clarity. My issues are pretty neurological, and so yeah, she suggested a specific, and it was a specific manufacturer, and it's a patch where you actually do a quarter of the patch at a time. And so she gave me a litany of information to research and said, if you feel it'd be helpful, go for it. But that's about all I can offer you at this point.
That sounds like my situation. Yeah, that's
Yeah.
that's the same kind of thing.
I mean, I used them when I quit smoking, and but I'm not certain. I think it's very early in the study. I don't even know if there's official studies about how it would help with Lyme's, but
yeah, I think it's a pretty recent thing.
Yeah.
And that would be pharmaceutical rather than herbal.
Yeah.
Yeah, I haven't heard about that one. I'll have to look it up. Yeah, I could see how it could help with like fatigue and brain fog and stuff because it's a stimulant, but I'm not sure what the mechanism of action would be for like pain. I'll have to look into it.
Thank you for your time today.
Yeah, thank you. Yeah.
Thank you so much, Nitya. This was a wealth of information. Everyone who's registered will get a handout and some links to the questions you asked. And also a link if you'd like to take advantage of Nitya's offer of a 15-minute introductory session.
Oh, yeah. And I can I forgot to share that before more people left, but I can share.
If you can put that up.
Yeah, give me 1 sec. I can put that up.
And thank you everyone for coming today. Appreciate the great questions.
Yeah, it was great. It was a very good interactive group. Okay, so this is the website, which will be on the handout that you get, cedarroseheals.com. And it says Greenfield, but I do telemedicine, and I'm also going to be in Brattleboro a couple of days a week, or a couple of days a month, maybe eventually a week. So then if you go to services, appointments, you can book a free 15-minute consultation here if you want to talk further about your situation and your case, and I can let you know if I think I'd be a good fit and be able to help you further. And there's also all kinds of things on here too. And if you want to, also the email, my email and phone number and website will be on the handout. So if you want to order a ticket, you can also email me there as well.
Thank
Yeah.
you so much for your time
Yeah.
today. And anyone who's interested in resources, you can go to our website at lymedrc.org. Thank you so much.
Yeah. Thanks, everybody.